My name is Larissa Dvorak. I'm a paramedic and an EMS sworn specialist with the Mesa Fire and Medical Department.
And my name is Veda Rohr. I'm a registered nurse and an EMS coordinator within the EMS division of the Mesa Fire and Medical Department.
Today, we look forward to sharing with you how the Mesa Fire and Medical Department can work together with your facility to provide the best care possible for our mutual patients.
Since our department responds to medical emergencies within your facilities, we want to try and ensure the smoothest transition between our staff and yours.
We're hoping this video will help to provide information for your staff regarding the roles, responsibilities, and expectations of the Mesa Fire and Medical Department when responding to 911 calls at your facility, and also to open up the lines of communication between our staff and yours. Firefighters work 24-hour shifts. They respond to many different types of emergencies, such as medical calls, fires, and technical rescue situations. When someone calls 911, the closest, most appropriate unit is dispatched. Our fire trucks include a captain, an engineer, and 2 firefighters. 2 of those personnel are paramedics and provide a higher level of care, and 2 of those personnel are basic EMTs. When responding to medical calls, our paramedics follow standing orders. Under those orders, our paramedics are able to start IVs, provide advanced airway management, administer 26 different drugs, treat and stabilize critical patients for transport for conditions such as chest pain, stroke, cardiac arrest, and respiratory emergencies, as well as serious traumatic injuries such as a fall that a patient may suffer in your facility. However, our standing orders do not cover all medical situations. For example, our paramedics are not allowed to initiate or monitor critical care infusions, and they also do not remove bodies of the deceased.
So when is it appropriate to call 911? There are emergent and non-emergent situations. For example, if you have a patient who's complaining of cold or cough symptoms and they have yet to be evaluated by your facility's physician, that's considered a non-emergent condition, as are interfacility transports.
You're right, Veda. There are situations where abnormal lab values are reported by the physician, and the physician wishes the patient to be transported to the emergency department for further evaluation. That would be more appropriate for an interfacility transport as opposed to a 911 emergency transport.
Another situation that's also considered non-emergent is if you have a patient who slips from their bed or their chair and they're on the floor, but they're not injured. They just need assisting getting back into their bed or their chair. Those are also situations that are considered non-emergent.
Yes, that should be a situation where the care staff facility would be able to manage that patient effectively. However, if your patient were to fall and complain of pain or have any visible injury, that would truly be a 911 emergency.
So what is an emergent condition? As Larissa stated, if you have a patient who has visible injury or complaint of pain as a result of a fall, a patient who appears to be in distress from a medical condition such as chest pain, shortness of breath, or abdominal pain, a patient who's not acting appropriately compared to their normal mentation, or a patient who is unconscious, unresponsive, or in cardiac arrest.
Before calling 911, notify the physician, follow your standing orders. Call 911 immediately for critical, unstable patients.
Sandy?
Yeah.
I was just on the 1039B. The lady down there is complaining of sudden onset of chest pain. I was wondering if you can call 911. I think she needs to go to the hospital.
Sure, why don't you go ahead and go down and stay with her? Get a CNA to get by.
When making the call to 911, the call taker will have a number of questions. Make sure that you provide to them the age of the patient, what symptoms the patient is showing, how long they've had those symptoms, what has been done for this patient prior to the arrival of their crew, and what is different about this patient today than what has been in the past, as well as what is the best way to access your facility. For example, some facilities prefer you to access a back door at night as opposed to a front door in the daytime.
When the fire crew arrives, please be sure that the door is unlocked and that a staff member is available to guide the crew to the patient. Once at the bedside, a staff member should be available to give a verbal report to the crew. That would include events leading up to, vital signs, past medical history, and any treatment that was done prior to the crew's arrival. At that point, the staff member can step back and allow the crew to assess and treat the patient, but should remain nearby in case there are any questions. At this time, the staff member can copy the patient's chart, which would include the history and physical, face sheet, medication sheet, and any other pertinent information to give to the crew. The families or the patient's power of attorney should be contacted as well. There may be a situation where your patient is left at the facility rather than transported to the emergency department. There are many factors that play into this decision, including patient choice. If the patient's medical condition or injury is considered low level, our online medical director may give us permission to leave the patient at your facility.
Oftentimes, treatment of your patient may result in a lot of debris left behind by our crews. A crew member will return to help you clean up that debris, unless it's a situation where the patient requires all the attention of all of our crew members. We hope that this video helps you better understand the rules, responsibilities, and the expectations that our crews have when they respond to a 911 call at your facility. Together, we can work to provide the best care possible for our patients.